Neurology Quiz number 6. What is SUDEP? This is sudden unexplained death in epilepsy. It includes non-traumatic, non-drowning related deaths and excludes deaths due to status epilepticus. Autopsy should not reveal anatomic or toxic cause of death. The occurrence is 1 in 4,500 per year in children and 1 in 1,000 per year in adults. It is the leading cause of epilepsy-related mortality. Risk of sudden death in epilepsy is 20 times that of the general population. Major risk factor is generalized tonic-clonic seizures, especially when poorly controlled. Other risk factors include longer duration of seizure disorder, polytherapy, mental retardation in male sex. Best preventive measure is seizure control. Risk of SUDEP is one more reason to encourage patients to comply with their AED regimen and to consider other treatments such as surgery to achieve seizure freedom. Mechanism may be cardiac, such as bradycardia, asystole, or arrhythmias, especially in patients with temporal lobe seizures, or respiratory from apnea and hypoxia. What agents are available for reversing the effects of direct oral anticoagulants? The direct oral anticoagulants directly inhibit specific proteins within the coagulation cascade. These include dabigatran, apixaban, rivaroxaban, and edoxaban. Dabigatran is a direct thrombin inhibitor, and the others are activated factor X inhibitors. Idarosuzumab is a humanized monoclonal antibody fragment developed as a specific reversal agent for dabigatran. The dose is 5 grams IV. Andexanet alpha reverses the effects of activated factor X inhibitors and was approved by the FDA in 2018. It is a recombinant modified inactivated factor Xa, which binds factor Xa inhibitors with high affinity. It is given IV and the dose varies depending upon the drug being reversed. What is the treatment for Lambert-Eaton myasthenic syndrome? Medications for symptomatic treatment are 3,4-DAP or amifampridine phosphate given in 3 to 4 divided doses. These drugs block presynaptic potassium channels, keeping voltage-gated calcium channels open longer and increase calcium output and acetylcholine release. Pyridostigmine can augment their effect but is not effective alone. Common side effects are limb and perioral paresthesias. Higher doses can cause seizures and should be used in caution in patients with epilepsy. For severe symptoms, IVIG plasma exchange are added. Steroids and other immunosuppressives can be used if no underlying malignancy is found. Coincident malignancy, when found, should be treated appropriately.